Hi, everyone, and thank you for joining us for what promises to be a really interesting conversation. I have joining me my wonderful co authors on the book Life Interrupted Understanding India's Suicide Crisis. We have Dr. Soumitra Pathare, who many of you know as NetShrink on Twitter, and if we get time, we'll talk about how it's going on Mastodon. He's currently the director of the Center for Mental Health Law and Policy at the India Law Society in Pune, India, and really the catalyst behind this entire book that we wrote. Which we're going to delve into a little bit more. Also joining us, Dr. Abhijit Nadkarni, also a trained psychiatrist, both of course trained psychiatrists, and Dr. Nadkarni is an associate professor of global mental health at the London School of Hygiene and Tropical Medicine, co-director of the Addictions Research Group at Sangha, which is of course a leading NGO working on mental health in India. So thank you both for taking the time. I know your schedules are pretty packed, given how the last few years have been. Let me start by asking you something about how it's been for you since the book came out. So this book that you are toiling over, which I will show everyone, which really tried to talk about India's suicide crisis in a very accessible way. So not academic, obviously not trivializing, but going through very specific case studies and showing the science and evidence behind it. How have you both felt since the book has come out finally, and what have the reactions been so far? Dr. Natkani?
Instead of kind of talking about how the reactions have been after the book came out, I want to kind of put a kind of fine line to it and contrast it. I just want to start off with when we thought about writing that book, and I was when the idea came up, I was like, no, Soumitra, sorry, can't do it. I can't write the kind of the way we would want to write a book like this. You kind of trained so much in academic writing, which is so dry and uninteresting. I don't think I can write interesting stuff. And Soumitra, being Soumitra, was pretty gungo about it. No, we can do it. You'll be able to do it. Let's do it. It's important, and let's just have fun writing something different from what we usually write, and it's an important issue to kind of write about. So I said, okay. Then he said, okay, let's get Amrita on board as well. I mean, she will make us look nice. All of that academic bits of it, she'll kind of cut away all of that faff and make this more interesting. I said, okay, let's do it. And then reality hit. It's not easy as we thought it would be. Kind of going to the grind of writing something which is about a kind of a difficult topic, and making it something that will that people will read, because there's no point in writing about an important topic if people are not going to read it. And so kind of getting into that and trying to make it make a serious topic interesting, which again was a big struggle. Uh, but then kind of the high of actually seeing the book and holding it and thinking, okay, this was all worth it, and so kind of the high of that, and then then it becomes slightly fuzzy in terms of not knowing who is reading it, what impact is it making, is it really making any difference, was it really worth it? And then suddenly you come across someone who kind of shows you your book and says, hey, I've been reading your book, and I've been making underlining it, and it's really influencing my work. And then you feel good about what you've done. Okay, so look, at least there's one person whose life or work has hopefully changed because of what we have written. So you kind of meet people like that, few and far between. You kind of get into that habit every time you're at the airport, kind of going into the bookstore thinking, is my book there? Are they stocking the book? And this is not to do with personal glory, because as an academic, our currency is different. It's kind of academic papers, etc. But it's more to do with, can we kind of get the message out there, and this is our way of getting the message out there, and you want to see if it's getting out there. So yeah, I mean, it's been an interesting up and down journey, and until Soumitra convinces me to kind of write again on other things, I think this has been an interesting journey. But both more important thing is that this should go out there, and people should read it, not just because this is our book, but I think of course there's a conflict of interest, but I think this is an important book within that space to um, what we initially kind of set out to do, which is basically kind of take this out of the mental health space, kind of change the narrative from suicide being a mental health problem to it being everyone's problem. And I think that was the attempt, and that's why we kind of want more people to be reading this, to understand that this is not about psychiatrists and mental health. This is way bigger, way beyond that. It's everyone's problem.
Yeah, that's really well said. Dr. Patare, between where you started this, and you did make it sound like it's going to be a fun, easy project, to the way it changed. And you were very clear also, you didn't want us to feed into some of these stereotypes. Obviously, we don't want to write a book that reinforces that kind of fatalistic attitude Indians have, or everyone has rather, to this issue. How have you felt on this journey? And what have been your sort of existential pangs along the way, like Dr. Nadkarni?
Yeah, I mean, I agree with Abhi that I didn't expect it was going to be so difficult writing it when we were writing it. Not because we don't know anything about it and we had to hunt, but the fact that, in fact, probably we knew too much, and to convert that too much into a simple way to get the message across in a narrative that is interesting enough for the general public to read. That was the challenge. I don't think the challenge was knowing what to write or what we wanted to emphasize. But look, I mean, as far as I'm concerned, for me, the book is a roaring success, and I'll tell you why. I'll give you the example why. Uh, about 6 months ago, I had a call, like just some random person, a random call, random as in just out of the blue, cold call, and it happened to be, and I'll not take names, but it happened to be a commissioner of police from a large city in India who said that he was trying to desperately track me down because he wanted me to have a conversation with him. And that was because he had read the book and he wanted to see how he could help and do something concretely to address the problem of suicide. And that has led to a thing where he then invited me over to visit the city, meet other people there, meet some of the government officials. And we are now in the process of actually planning a good program for the city in terms of addressing the suicide problem, working with government and with the police. I mean, if you're looking for impact, as far as I'm concerned, that is impact. I mean, the whole idea of writing the book was to kind of have that impact, that people don't just read the book and say it was wonderful, but people read the book and go out and actually do something to change the reality. And here was somebody in a position where they could make that difference, making that difference and doing something about it. So, that's for me, that one thing is going to impact the lives of millions of people in one big city. I think that's as good as, you can't be asking for more. I mean, that should be good enough for us to be able to say to ourselves that we've got pretty good impact of the book.
That's incredible to hear. That is actually huge. I think that you're right. That is real life impact. And on a lighter note, everyone is whacking our copies. So anyone watching this, that's also impact. You can see there's interest because people want us to give our copies. If any of you who are watching this have read this book or are interested in this book, please do check it out and do give us feedback. Dr. Patari, let me ask you a little bit, and I'm going to now, just try and remove this, see if I can ask you this and remove myself from the screen, and put some of this information up. As we decided to chart this book, it was very clear for all of us, and we'll have another show on the highs and lows of the writing process because it's gone through so many iterations. But we were very clear we wanted to address different stakeholders and have sort of very actionable information, right? So, I mean, the media chapter for me was obviously very interesting to work on. We talked to so many journalists. We have policymakers we felt that this book will be relevant to as well. Can you take us through a little bit about what's actually in the book? And Dr. Patari, you can start. And also, what's changed since the book has come out, just in terms of some of the numbers and all that have gone up? I mean, let's put that in context too.
Okay, let's start with the easy part, or the harder, the not so nice part, which is the numbers. When we wrote the book, the 2020 numbers had not yet come in. This is the pandemic year, and even the 2021 numbers were not in. And what we have is actually a pretty depressing situation after that. In 2020, which is the year of the pandemic, suicides in India went up by 10%, and then that has been followed up in 2021, that they went up by another 7%. This is highly depressing for the simple reason that we hit the bottom of our suicide rates around 2017 or so, so that they for the first time dipped under 10 for a while, and then from there they've been gradually rising by 1 or 2% each year, and then in 2 years we've added 17-18% increase in numbers. This is like huge. It's just blown out all the gains that have been made in the last decade. And last year's number, which is for 2021, which is 12 per 100,000, I've been looking up. That is the highest number. That is the highest rate of suicide in the last 40-45 years at least. I've not gone beyond the 40 years. I think I checked up to 1980, and we've never had a number of 12 per 100,000. And I know that there is NCRB data stretching back to 1965, and maybe I should get one of my team to look up those numbers. But maybe it's an all-time high ever. We've never had this number of 12 per 100,000. So that's the depressing bit about it. The even more depressing bit is that in 2020, while suicides went up by 10%, suicides under 18-year-olds, this is kids under the age of 18, went up by almost 20%. They were like up by 19%. So twice the number. These are horrific numbers, and unfortunately, we don't see any discussion about it or any urgency to address the issue. There's just some complacency. Either it's a complacency or it's fatalism. I don't know. I don't know which of the two it is. It could be either, or maybe it's both. It's complacency, fatalism, and just an unwillingness to address. And maybe life is too cheap in India, and so we don't kind of bother with it. So yeah, those are really worrying issues for me. We've got after a lot of effort, we finally have something called as a National Suicide Prevention Strategy, which the government put out recently. Uh, I would have expected. I mean, it's good that we've got a strategy, but I hope that, and I was expecting that there would be much more action on that strategy. So it's a bit disappointing. For example, in this budget, for example, while a lot of crores of rupees were devoted to starting a telemental health program, there was absolutely no mention of the National Suicide Prevention Strategy, or actually allocating money for doing some of the things that the National Suicide Prevention Strategies is trying to do. So that's a bit of a depressing bit. And the other point was, we make a big, we talk about you talked about earlier also about the whole role of media, for example. The role of media, now this is actually as close to a no cost option that we have. Media changing its behavior is not costing anyone anything in terms of financial cost. There's zero financial cost for almost everybody involved to change some of their behavior. And media is the one who lectures everybody in the community about how people should be changing their behaviors, professionals should do this, and politicians should do that, and policymakers should do XYZ. But when it comes to the media themselves, it is actually quite depressing to see the reluctance of the media to bring about any change in its behavior. So, and you'll say, why are you saying that? Because I'll give you a concrete example. I even tweeted about it this morning. We've created a course for the media. It's 2 hours long. It's online. It can be taken at your own convenience. It's free. And we've been trying to get journalists to actually do this course. This is about responsible reporting of suicide. Why are we trying to get them to do this course? Because there's data to show that if journalists, if we reported suicides more responsibly, you could reduce suicides by anywhere between 1 to 2%. Now, even in the context of India, 1 to 2% is going to mean saving close to around 3,000-4,000 lives. Okay, zero cost to anybody. 3,000-4,000 lives at zero cost to anybody in terms of money required or no resources required, nothing. You have a course which is training the journalists to do it. It's 2 hours long. It's free. It's online. I really don't see the reason why journalism schools, journalists, editors, media houses, why the reluctance to do that? Why the reluctance to say, well, we'll make this mandatory for all our journalists, for example, to have done that? The journalists love to, and media loves to kind of point fingers at everyone. But, I do think that it's time for the media to also introspect and say, well, while we are asking the world to change in many ways, how much change are we willing to do, even on things where it's costing us nothing? And when
Yeah.
there is evidence that change in our behavior will result in saving lives. So yeah, that's really frustrating for me.
That is, and that's something I mean, definitely will talk to more journalists about. I think just speaking to some of them, we've realized that there's still that gap somehow in awareness. Like I think when we do some of these talks or workshops, we feel that it's pretty self-evident. These are the guidelines, like you said, do the course. People do want to do the right thing, but I do agree with you. I think that gap between making it mandatory or having the buy-in at the level of editors, not just individual journalists, is going to be so critical. Um, I'm going to come back to this in a moment when we talk about again, the reverse of this. If you do this right, like you said, you can be saving lives, but you can also be having an even wider positive impact in terms of the media. Dr. Nadkarni, when you're looking at some of the points we make in the book about suicide being a multifactorial issue, it's not just about mental health and mental illnesses. I learned working with you guys as well, looking at the research. What are some of those misconceptions you think we really need to get out of the way so that people can start implementing life-saving policy? And I'm just going to say we are putting helplines up at the bottom because this can be a very, very triggering subject. So if anyone is watching and feeling distressed, please reach out for help. Not talk about it. And then I'll have those helplines up in a second as well.
So before I go there, Amrita, can I just kind of add on to what Soumitra said about media? Because I don't really agree that there are no financial costs to kind of change. I think there are financial costs to change, because we all know when it comes to media, and media caters to what society asks them for, sensation sells. And there is a cost. I mean, if there's a financial gain by kind of sensationalizing anything, including suicide, and when you speak to journalists, and because you spoke about the training, I think when you speak to journalists, what they usually tell you is, we are happy to do this, but and even if we follow what the guidelines are, by the time our piece gets to the editor's desk, it changes. And so I don't really know whether training is the answer. The answer probably lies in the costs, but in the other direction, and as far as I'm concerned, i.e., if behavior has to change, then there have to be consequences for not doing what's right. And unless there are consequences to people continuing to do report in breaking these guidelines, unless there are negative consequences or punishment or taking away of positive reinforcement, these behaviors are not going to change. So there needs to be costs, but the costs need to be in the other direction in terms of the consequences or the negative consequences of continuing to do what they are doing. Um, and the other bit about why we kind of go round and round in circles about this, because you said, Soumitra said something about complacency or fatalism. I would want to add another bit to it, which then again addresses the question that you asked me, Amrita. So there's complacency, there's fatalism, but there's also laziness in terms of attributing why this happens. And that laziness is seen in how we kind of put everything related to suicide at the doorstep of mental health problems, because it's an easy explanation. You see, mental health problems lead to suicide, and hence kind of doing away with that laziness and addressing some of the other issues. And then some of this kind of also kind of lies at the doorstep of us mental health professionals. We need to be countering this narrative, right? And as mental health professionals, as psychiatrists, we need to be countering this narrative and saying, don't put everything at our doorstep, because it's not all mental health. And some of the things that we address in the book as you know, and as people who have read it will know, is kind of looking at other aspects related to people dying by suicide. We've spoken about the elderly and loneliness. We have spoken about women experiencing violence, intimate partner violence or domestic violence. We've spoken about drinking problems, not as a mental health problem, but drinking as a societal issue. So these are some of the, and we have spoken about caste, we have spoken about marginalization, we have spoken about the education system, we have spoken about the agrarian crisis and its effect on farmer suicides. So we kind of try to do everything except speak about mental health as the driver for people dying by suicide. Mental health might be the final, the final domino that falls, but there are a lot of things that are happening upstream which we don't talk about because it's more difficult to deal with those. It's more difficult um, for policymakers to find solutions and implement those, like poverty, like violence, like agricultural reforms, like caste. These are more difficult issues to resolve, and so it becomes easy to kind of say, let's take care of depression, let's put in programs in place for depression, and this issue will go away. But we know that kind of working on the final downstream factor which might lead to people dying by suicide is not the solution if you're not going to look at the upstream factors. And these are some of the things that we have kind of very consciously elaborated on and expanded on in the book, and not on the mental health aspects of it, because there's a lot of talk about that. But I think that is kind of giving it a lot more credit than is due in terms of what leads to people dying by suicide, and not talking enough of the actual problems.
Yeah, and that does seem to be the easiest narrative, right? I mean, I think as someone who's come to this as a layperson, as a journalist, what I realized the more I was working with you both and going through all these people papers and the research is that we default to that narrative because that's also what's kind of propagated in the media. Dr. Patarian is kind of like this vicious circle, which is kind of why we wanted to do these very easy to understand chapters for people to realize that there are so many complex issues. I do want to inject a little bit of hope, as such as we can in 2023, given the state of the world. But even in Dr. Patari, actually, I think introduced me to Dr. Lakshmi, who's of course this pioneer in the space of suicide prevention, setting up the first helpline in the 80s with Sneha, which is still running. That's the number on the screen. When she was, as we were talking about suicide contagion and this Werther effect, she brought up also the Papageno effect. And I think one note for journalists, the research she was doing when we were doing the book was about the uptick in suicides whenever there's reporting around a celebrity suicide. And I think coming back to what Dr. Nadkarni was saying about what sells in terms of sensationalism, unfortunately, the media will not shy away from reporting on a celebrity suicide. So it's very distressing to know that that's directly being linked to an uptick in suicide attempts and suicides in the world. But she said that there's this thing called the Papageno effect, which is if you can show people resolving life crises, and of course we're not talking about false positivity or putting a spin or any of those toxic filters or whatever, but if you can show somebody realistically going through a life crisis, resolving it without taking such a drastic step, it can also have a positive impact. Dr. Patare, can I ask you a little bit about that and also some of the work you've been doing on the ground, including with the projects there, the Atmiyata project and other things that are showing that there are things we can do? Because again, I think the bigger challenge is once we have normal people looking at issues like this, normal as I mean laypersons, not experts, you think, oh God, you guys have just said everything. There's a structural reason for this, right? Socio-political, there's all of these. We can't do anything about it. So can you take us through some of the things that are shown to be having an impact?
Yeah, certainly. And before I do that, I just wanted to pick up on what you said and actually continue to on what Abhijit said. This. Look, this is this. I feel that conscious, like almost like a conscious decision. Our societies, not just Indian society, but all societies across the world, have in the last 2 to 3 decades. Uh, Kind of chosen to take this approach where we've made mental health or suicide a kind of individual problem, that this is a problem of individuals. And so the target for changing it then has to be individuals. So you focus on the individual and say, well, you need to change that. And we've seen that in mental health happening. We've seen that happening in suicide, and increasingly we are seeing that happen in the whole narrative around workplace mental health. The one single big driver of workplace mental health is the toxicity of culture at a workplace. And instead of addressing that head on, we try to say, well, we'll provide you with individual support. And for me, the whole resilience narrative that is being built up, this is like saying, you have to become resilient to not be affected by obviously living in a pretty shitty world. Without actually saying, look, we better change the situation in the world rather than just talk about these resilience issues. So I think there's almost like a conscious decision that societies have made, that our policymakers have made, and our corporations have made, to avoid any discussion about the broader structural issues which lead to it, and make this a problem of individuals and shift the onus and responsibility onto individuals to improve their mental health, as opposed to saying that there's an onus on society to create conditions in which people can have good mental health or prevent suicide or have better work experience, all of that. So I think that's really and how can we change that so that we can shift the narrative back to where it actually belongs, which is, it's a little bit like trying to make if you got a lot of kids getting asthmatic attacks living in a polluted city, for example, let's say Delhi, just as an example, then to say this is a problem of the kid rather than addressing the pollution in the city is exactly what we've been doing with mental health, we've been doing with suicide, we've been doing with workplace mental health, all of that. So I think we need to actually be able to shift that narrative back to where it belongs. But that's not, I don't see that happening, and I'm hoping that people reading our book are able to understand the need and the importance to shift that narrative back to where it is. That's what Abhijit was talking about, just shifting the narrative back to where it is, where the biggest impact is, which is the broader structural factors which drive all of these processes. In terms of what media can do, like clearly, just like you have the issue that badly reported suicide stories increase rates of suicide, you equally know that well reported suicide stories, that is following guidelines, and if media as a whole started doing that, then clearly that there is research evidence to show that you will get reduction in suicide. You will find that suicide rates go down, suicide numbers go down. So there is actually a positive effect. Normally what happens is when you say, oh, don't do something because it will stop something negative happening. In this case, not only does it stop the negative happening, it actually produces a positive effect too. So doing something which is changing behavior in terms of reporting will actually produce a positive effect in terms of reduced suicide numbers. So clearly that's something that we should be chasing up. What I don't know how one can do it, but I would love to actually be able to talk to media and media leaders, really, like say the journalists associations, the editors associations, owners of media houses, for example, to try and understand what is the inertia about change. Why is the reluctance to change? I mean, Abhi says one thing which I think is a driver, and you said that too, that sensationalism sells, and so there is a vested interest in sensationalism. But you have to understand that if nobody did it, then nobody stands to lose, if you see what I mean. Like if a few newspapers stop being sensationalists, then they stand to lose on the audience, so as to speak, or the eyeballs. But if everybody agreed not to do it, then clearly that's not going to result in a loss of eyeballs for anybody, if you know what I mean. So it's an example of how collective behavior in a certain way ensures that nobody stands to lose anything.
So
Now,
actually,
why?
can I jut in here for just a minute, actually, and I do want to come back to the hope question, which will probably end on to both of you. When you're talking about the impact the media can have, I think one of the things, as when I was a practicing journalist, for example, you don't always stop to think about that. You don't realize that the story I'm telling, the way I'm framing that story, because obviously the art is in the framing, right? I mean, what I'm leaving out versus, and in any subject that you choose to pick up. I do want to link this back to what I was asking you both right before we started recording. When something horrific like this happens, and someone dies by suicide, the family members, people who love them, the wreckage, that kind of decision, there are so many repercussions to that discussion, to that decision. There doesn't seem to be any sort of guidelines or information that's also getting out there, whether it's from the media. Is that the best channel? Is that the best distribution mechanism for individual people to deal with something like that? How do you deal? And we've talked to survivors of suicide loss for this book as well, and they do talk about this shame, guilt. Nandini Murli said, for example, that she didn't feel like she could mourn the loss of her husband the way, if he had died any other way, she would have been able to. So, can I ask you both, Dr. Pathare and Dr. Nadkarni, just to take us through how do we address that? And is that something that the media should be taking sort of responsibility for, or are there other ways that we should be looking at societally?
You know, in most countries, or at least in countries which are addressing suicides far more actively, proactively. In most countries, you'll find that there are services which the technical term for it is postvention services. What that means is that there are services available for family members and near and dear loved ones of people who died by suicide. Just exactly to address the kind of emotions that they are left with, that Nandini talks about in when we spoke to her about the loss of her husband, the shame, the guilt, the kind of self-blame, the anger, and helping families deal with that, and helping near and loved ones deal with that. We have absolutely, I mean, we have at least a modicum of some services like like helplines and all, but we have no postvention services. I don't know of any organization or any government run postvention service which is available for people who have lost someone to suicide. And that's a huge hole in what we don't have in terms of services. Now, why is that important? I mean, we have about 150, 160,000, 200,000 suicides every year, which means that there are about 200,000 families each year. And if you add that over 5 years, then you're talking about a million families whose lives have been touched by suicide in a negative way. And so there's a million families out there which are living with that trauma, with the grief of it, and not having received any kind of support to be able to process it or do something with it. And we know that left unprocessed, it leads to further problems downstream for the survivors themselves in terms of their own mental and as well as physical health. And even more tragic is that we have about 10 to 11,000 suicides by children under the age of 18. So that means there's about 10,000 families, parents, 10,000 parents of minor children who have died by suicide out there, who are receiving absolutely zero support to be able to process and come to terms with their loss. And it's particularly tragic for the parents, so to have lost a teenager or an adolescent to suicide. So I think that's something that we need to urgently be doing something about. If there is anyone listening here who is in any position to either start a service like that or fund a service like that, I think that's what we need to do. That's something that we need to really, really get. It's also one of those things which is what I would call a low hanging fruit. What I mean by low hanging fruit, as in there's no doubt that it is useful, and there's no doubt that it will help people. So it's not even something. It's not into the more contentious issues where people might have debates and arguments, like for example poverty that Abhijit talked about, how to address it and all, farmer suicides where there might be debates about the causes and all. But post-vention services, there's absolutely no debate about providing some support and help to people to do it. So I think we should really be focusing on these pretty easy to do things which are not that difficult to do. Post-vention services also don't require mental health professionals. You can have non-mental health professionals, just like our suicide helplines are really run by trained volunteers. You
Yeah.
can have trained volunteers running post-vention services, for example. So I think there's lots that we can do. It just needs us to get up and say, look, let's get on and do it now. Yeah, Abhi, I'll hand over to you. You might have something more positive to say than I do, actually.
we have to balance it out, I guess. The thing about hitting rock bottom is that you can only go up from there, right? I mean, all this while we hit rock bottom a long while ago when it comes to this issue, and what we have been doing all this while is kind of to continue digging. I think we have to stop that and start to make some of these changes. And as Soumitra said, I mean, some of these changes are going to be relatively simpler. Some of them are going to be more complex. But for us to be able to make those changes, we need a lot more people coming on board, from different sectors. And you get tired of saying this. But I think it needs to be said. It's a multi-sectoral problem, and hence we need to have a multi-sectoral response. And until such a time that we keep talking about it being a mental health problem, those sectors are not going to come on board. And so we have to stop doing that and get all of these other different people, such as the education system, the police, the media, all of them on board to resolve some of these various upstream factors that lead to people dying by suicide. We are not going to be able to make a change. And as of now, I see a reluctance to do that. And so we've spoken about some of these reasons to do that. I think we need to kind of overcome that reluctance and start working together or independently within those sectors, if people want to make those changes within those sectors, if we have to be able to shift the curve, so to say, when it comes to people dying by suicide. If we don't do that, we're going to be here 10 years, 15 years, 20 years down the line, having the same conversation and writing similar books. I think we kind of way past that. And the only way to change that is to kind of change this mindset and then get all of these people on board to make this change happen. And I think we can do it. I think we can do it.
Okay, well, I mean, I'll take that if you both have not given up hope and you're still trying. I know that, half an hour is not enough to get into all of the details we want to get into, but I'm going to use this opportunity to thank you both so much for taking the time, for the work that you do, for, working on this book, which of course took on its own life form, almost practically making us do so many changes. But we'll also take this opportunity to talk to any of the journalists who are listening. We're here, we can help set up workshops, meetings. I think if that's the easiest, like Dr. Pathare called low-hanging fruit, if we use that, I'm sure that's something we can work on, including, our friends in the media. There are a lot of people, a lot of editors who do want to know how they can make an impact. So let's take that on. But yeah, I guess for the moment, thank you both so much for taking the time.
Thanks, Amrita. Always a pleasure.
Thanks, Amrita. Thank you.
Take
Bye-bye.
care. Bye.